Today, we're going to dive into a case study that starts with something you almost certainly have in your medicine cabinet: Tylenol. We're going to unravel a pretty serious medical emergency that shows how this super common remedy can become a life-threatening poison, and why those first few minutes of treatment are absolutely critical.
Here's how we're going to break it down. First, we'll look at the overdose itself. Then, we'll try to decode the patient's symptoms and face the exact same tough choice the first responders did. We'll walk through the options to find the right first step, and finally, we'll zoom out and see what this one case tells us about the bigger picture of emergency care. Let's get into it.
So just as I promised, our story starts with something you see all the time. Acetaminophen, or APAP if you want to be technical, is the powerhouse ingredient in Tylenol and a ton of other medications. It's our go-to for headaches, fevers, aches, and pains. We really don't think twice about it. And that's exactly what makes this whole situation so important to understand.
Okay, so here's our scenario. A man has taken an entire bottle of extra-strength acetaminophen. When the paramedics arrive, he's awake, he's talking, but he's complaining about feeling sick and his belly is tender. Now, on the surface, this might not look like a huge five-alarm crisis, but trust me, it is.
All right, let's play detective and decode the symptoms. The patient's body is definitely sending out signals, but they can be a little tricky to interpret correctly.
At first glance, the signals are actually pretty misleading. Look at his vital signs. Everything seems more or less okay, right? Blood pressure stable, breathing is fine, his oxygen is at 95%. Nothing here is really screaming emergency. But these numbers, they're hiding the real story.
The real clues are his other symptoms. He's got malaise, that's just a general feeling of being sick, and something called RUQ pain. Now that stands for right upper quadrant pain, and that is a massive red flag. Why? Because that's the spot in your abdomen where your liver sits. That pain is telling us this man has already hit stage 2 of acetaminophen toxicity. His liver is under serious attack.
And this brings us right to the heart of the matter, the treatment dilemma. So let's put you on the scene. You're the first responder. You know what he took, you see the signs of liver distress, you have to make a choice, and you have to make it right now.
So, what's the call? What are you going to do for him? Right here, right now. Are you going with an IV saline lock, high-flow oxygen, a big dose of activated charcoal, or sodium bicarbonate? Take a second. What's your gut telling you?
Okay, let's break all of these options down and find the correct first step. And the easiest way to do that is to figure out why 3 of them are actually the wrong move.
Let's start with high-flow oxygen. We can get rid of this one pretty fast. Remember those vital signs? His oxygen saturation was 95% on room air, and his breathing was totally fine. He just doesn't need it. Simple as that.
Well, what about activated charcoal? Isn't that what you give people who've ingested a poison? A lot of the time, yes, but in this case, it's too late. The source material couldn't be clearer here. It's of no benefit. The drug is no longer in the stomach, it is systemic. In other words, the poison isn't waiting around in his stomach to be soaked up. It's already been absorbed and is flowing through his entire bloodstream.
Okay, so that brings us to sodium bicarbonate. This is a much more advanced move, and to use it right, you need specific data from a blood gas analysis. That's a test they do in the hospital. Giving it to him out here in the field would basically be a shot in the dark, and you can't guess with this stuff.
And that leaves us with only one answer left: A. You see, the first responder's job here isn't to cure the patient, it's to support them and get them to the hospital where they can get the definitive cure they need. That means getting an IV started, putting them on a heart monitor, and hitting the road to the hospital immediately.
So why is getting to the hospital the only right answer here? Well, that brings us to the bigger picture. In a case like this one, speed and the right location are absolutely everything.
This number right here explains the urgency. Acetaminophen gets absorbed incredibly fast. It can reach its peak levels in the blood in as little as 30 minutes. That means by the time our patient was even showing symptoms, the drug was already everywhere in his body, doing damage. The clock started the second he swallowed those pills.
And this is why transport is the #1 goal. There actually is a specific antidote for a Tylenol overdose. It's called acetylcysteine, or acetaminophen. But, and this is the absolute key, it can only be given at the hospital. Every single thing you do in the field is just to get the patient to the one place that has this life-saving drug.
So this whole case proves that just because something's familiar doesn't mean it's automatically safe. A common pain reliever, when it's misused, becomes a systemic poison that needs incredibly fast and specific hospital care. It really leaves you with a question, doesn't it? What other common things in our daily lives do we maybe completely misunderstand?